Welcome to the WRAL Daily Download. I'm Jack Hagel. State lawmakers are weighing important changes to hospital regulations, and they could change how much you pay for care. The provisions would help UNC Health and Atrium Health expand. They're already two of the biggest hospital chains in the state. Legislators who support the changes say they want more options for consumers, especially in rural areas. But the Federal Trade Commission has some concerns. WRAL state government reporter Travis Fain has been digging into the issue, and he joins us now.
Glad to be here.
For the average patient, this is fairly complicated. So, from a high level, break down what's happening here in the legislature in particular.
So there's a bunch of stuff happening. Let's start with two things that are being discussed. One is a bunch of lawmakers want to give antitrust protection to UNC Health and ECU Health, which used to be called Vidant. It's out in eastern North Carolina. UNC Health, particularly, it's a multi-billion-dollar organization statewide, and lawmakers say they want UNC Health to be able to be the provider of last resort, particularly in rural areas, and they want this antitrust protection. But antitrust exists for a reason, right? So what can and will UNC Health kind of gobble up if they get this ability to not have the federal government step in and say, hey, this is bad, this is anti-competitive, will prices go up? That's the concern there. The other piece of language affects Atrium, which is in Charlotte. Now, Atrium is also a massive player in the hospital industry, and they're actually organized in North Carolina as a local authority, a county hospital authority. It's a throwback to decades and decades and decades ago. They have some extra powers because they're kind of a quasi-government entity. One of them is some eminent domain powers, their ability to take property. Another is they already have antitrust protection, but they're forbidden from expanding in North Carolina, with some exceptions, outside of a 10-mile radius from the boundaries of Mecklenburg County, okay? So they're kind of constrained in North Carolina. That would go away under this proposal. So now you have these two beasts with kind of the shackles off in some people's point of view. So what does that do if these two entities have antitrust protection all around the state?
And so this is part of a broader effort to change healthcare-related laws in the state, right?
Yeah, that's right. So any legislative session has got a lot going on. And just one day I looked up and I was like, man, this is the healthcare session. Everything else that's happening is important, but we are potentially making some really foundational decisions about healthcare policy and how the hospital industry works in North Carolina. Because it's not just hospitals, right? Like if you're a hospital, you also own doctors' practices. And it just comes, you wake up one day and there's like 16 entities doing it all. Kind of from soup to nuts, controlling the process. What does that do to prices? And then you've got, on the insurance side, a bill passed earlier this session to give Blue Cross Blue Shield, largest insurer in the state, to allow it to reorganize and move its money around in ways that it hasn't been able to, that's going to allow it to grow. So, Goliaths are kind of getting bigger, and there are other Goliaths too. This is the question is how much competition is really in the industry right now and how much is about to be there. We also expanded Medicaid this session. That's billions of dollars in government money that's going to go to hospitals and to doctors as more people are insured. There's a bunch of money in the state budget for new facility construction. That's going to be part of ECU Health and UNC Health partnering if all this passes. We did something called Certificate of Need Reform, which is a kind of a pro-competition. So we're kind of moving lots of levers. I'm not going to get into what Certificate of Need is, but basically right now it limits hospital expansion without a regulator signing off. So we're stripping some of that down. We're just moving all these levers on healthcare. And I can't get anyone to kind of articulate what the overall goal is, what the overall narrative is, and what this leaves us 5, 10, 15 years down the road.
So with the hospital plan, if that goes through, in lawmakers' view, what does that mean for me when I go to the doctor or the hospital in theory?
So from the proponent's point of view, it means UNC Health, think of them, I hate to dumb this down this much, but think of them as kind of considered to be a good actor in healthcare in North Carolina. It makes them bigger and stronger. They are very involved in rural healthcare. Their executives told me, like, look around in rural North Carolina. Who else? Who else is in rural North Carolina but us and ECU Health? So lawmakers want them to be the provider of last resort. They want to give them this kind of more clear government power to, instead of waiting for a hospital to fail in Randolph County, which came very close to happening a couple years back, they want UNC Health to be able to go in early and kind of soak that up, partner with them. But in order to do that, you have to have some conversations about what prices are, that the Federal Trade Commission might see as anti-competitive and kind of put the kibosh on before that happens. So that's the idea as it's been explained to me.
So that makes sense. The bigger the hospital chain, the more leverage it has in negotiating cost. Does that mean they profit more, or are they going to pass those savings on to me?
Well, I mean, when was the last time you looked at a hospital bill or a doctor's bill and thought, wonderful, I'm extremely happy with what I've been charged here. This is clear. It's easy to understand. This is a problem across the healthcare system in the United States. So I'll leave it to other people to kind of opine about what costs will go up, costs will go down. There's kind of an argument both ways. But I mean, some of this is the big boys getting bigger, but it's also the big boys getting bigger, or the big girls getting bigger for that matter, in a world where everyone is getting bigger, right? So, I mean, all these different hospitals, they're buying up doctors groups, they're expanding, and I don't know if this is the legislature trying to make good Goliaths to battle bad Goliaths, but that's kind of what it reads like to me.
Let's take a quick break. When we come back, we'll hear about why a federal regulator is involved and what it has to say about the effort. Stick around. Welcome back to the WRAL Daily Download. We're talking with WRAL state government reporter Travis Fain about an effort to change hospital regulations in the state. Travis, in the lawmakers' view, as you mentioned, this will help people in rural parts of the state. How?
So it's tough to run a hospital in a rural area. You just don't have the money flowing in. You're not a large hospital, typically. You don't have some of the procedures. You know, you're sending people to Chapel Hill or to Raleigh for certain procedures that are often kind of the bigger money makers. But we need you there, right? Because you can't be too far away from a hospital when an emergency strikes. And we've had a number of hospitals over the years that have failed or come close to failing. And Medicaid expansion, which I think we mentioned earlier, will help with that. It's going to pump all this money into the system as there are more payers. But there are still concerns that rural hospitals are going to struggle financially. So the idea is, all right, let's set UNC Health and ECU Health, these university-connected large hospital systems up to partner with rural area facilities. And prop them up may not be the right word. I mean, some form of merger, some form of partnership. There's also hundreds of millions of dollars in the state budget, the Senate state budget proposal, working its way through RAW now that would build more clinics in rural areas. So the idea is, all right, let's do these antitrust protections so these conversations can happen ahead of time, and UNC Health and ECU Health can kind of bolster rural healthcare without regulators looking over their shoulders and saying, nah, that was anti-competitive. You can't do that.
Now, the Federal Trade Commission, which signs off on these kinds of deals, they seem to have some misgivings about all this. What's their role?
Oh, yeah, big misgivings. They wrote a letter, 9-page letter, 4 pages of it are footnotes, if that tells you anything about kind of the legal nature of all this. And it basically says, hey, lawmakers, don't do this antitrust thing. That's a bad idea. A real bad idea. I mean, they did not mince words at all. And they said UNC Health does not need antitrust protection to do the kind of things that you seem to be talking about. What antitrust protection would give it is kind of an anti-competitive advantage. It could raise prices. It could depress wages for hospital workers because one of the things that antitrust does is it just limits how you talk to your competitors. And if some of that goes away, it has a lot of ramifications for patients, and it has a lot of ramifications for your competitors, and it has a lot of ramifications potentially for your employees.
What do people outside the deal have to say about this? The experts, competitors?
So experts are against it. There's a guy named Barack Richmond at Duke University who's kind of a guru on this sort of stuff. And you want to talk about pulling no punches. He called the UNC antitrust proposal idiotic. He said it is basically 180 degrees away from what experts across the country think we ought to be doing, which is boosting competition in this sector. It was real hard to get hospital executives from other entities around the state to talk to me. A few did, but kind of anonymously. I mean, these are really sensitive issues. But the language they're generally against it as well. And the language that we talked about with Atrium. So we've been talking about two things: UNC Health antitrust, and then Atrium, which already has antitrust abilities, but is limited in how it can grow. And the legislature is considering changing that, giving them kind of steam to grow further across the state. That's something that other hospital groups have been fighting for years at this point. Atrium has wanted it for quite some time. It kind of emerged from the shadows in 2018 and got beaten back. And it's a constant fight. And a lot of those fights happen at the legislature.
And what do UNC and Atrium have to say?
Atrium wouldn't talk to me. Apparently, Atrium does not recognize my existence because they did not return my emails or calls over the space of like a week and a half. UNC Health engaged with me, and I appreciate that. I mean, they basically say, this is one part of a larger rewrite of rules that we live by that really haven't changed a lot since 1998 when we were a small outfit getting state dollars. I mean, now we're a, 6, 7, I don't know how many billions dollars entity. We're across the state. And they say, look, rural healthcare in North Carolina, other than us and ECU Health, who's doing it? No one else is doing it. We need to be freed up to do it better and to do it in more places.
How did this all come together? I mean, whose idea was this and how did it gain traction?
So the Atrium idea is something that Atrium has been pushing for years. I mentioned back in 2018 it kind of emerged, but I suspect that every legislative session some form of this conversation is happening, and it's just a question of whether or not they're able to get it written into a bill. This year they got it written into the Senate budget, which, like I said, has all these other things in it, is hugely important, and sometimes small things take a little rider. And sometimes those small things are not so small. The UNC Health thing came out of an 18-month or 2-year rewrite of UNC Health's bylaws is probably not the right word since they're written into state law, but kind of the rules that UNC Health is organized by and lives by. And like I said a second ago, that they just felt like a restructuring. It was time for that, and they included this antitrust language in there, which is the only controversial part of it, to my knowledge. They included that in there as part of that rewrite, and then took it to the legislature, and the Senate so far has said we want to do this, and the House so far has said, I don't know about that. So we'll see if any of this happens.
So a month ago, we expected the budget to be wrapped up by now, and lawmakers are going to leave town for the summer. Where does that stand? And also, could this effort change in any way?
So, yeah, those were the days when we thought the budget would be done by July 4th. It probably is looking more like mid to late July under the optimistic schedule for the state budget to get done. As far as, this absolutely could change. I mean, anything can happen in a legislative process until everything's signed on the dotted line and there's an agreement. This is going to be negotiated at the highest levels, the leadership in the Senate, the leadership in the House, like rank and file members, even who delve deep on healthcare policy. When I asked them about this, they're like, I don't know anything about it, because it is only going to be the two top guys in the House and the Senate that are hashing this out as part of the budget process. And ultimately, we may look back on this as the healthcare session. We may look back on this despite everything else that happened. And remember, abortion laws passed. And I mean, of course, that's healthcare too. But we may look back on this and see these foundational changes. Boy, they were big for generations to come.
Well, I know you'll stay on top of it as it develops. Thanks, Travis.
Thank you for having me.
That's WRAL state government reporter Travis Fain. For his coverage of hospital regulation in the state, visit nccapital.com. I'm Jack Hagel. Thanks for joining us, and thanks for listening to the WRAL Daily Download and for making us part of your morning routine. Another great way to get WRAL news is the Morning Briefing newsletter. It's a daily email that arrives in your inbox every morning with Triangle news, events, and headlines to help you get ready for the day. Sign up at WRAL.com/newsletter.